Our next guest has a new book out, and he says Obamacare did not do a thing to make health care more affordable, to drive down the costs. Stephen Brill is a veteran journalist. He's author of America's Bitter Pill: Money, Politics, Backroom Deals, and the Fight to Fix Our Broken Healthcare System. I don't have enough time to go through all of Stephen's credentials, but they are impressive.
Thanks. And
you've written an entire book about Obamacare, and 60 Minutes did a long piece using you as their primary expert. And the terms used on 60 Minutes were an orgy of lobbying and backroom deals that were ultimately bad for the taxpayers. What about the claims by the administration that this law has driven the cost of health rising as quickly as it otherwise would have?
And all the stats they use are for the year actually before Obamacare went into effect, before the exchanges was started. So it's not really relevant. And more important, if you read the law, as you used to do in your prior life, if you actually read the statute, except for a few paragraphs sort of at the edges, there's nothing in the law that is intended to cut the cost.
And it doesn't, you talk about in the book, because there were too many people who had money at stake, who had a lot of influence over the players in Washington, including Big Pharma.
This is sort of the ultimate in crony capitalism. The pharmaceutical industry made its deals. The medical device makers made their deals. These so-called non-profit hospitals, which, as I point out in the book, are usually profitable, they made their deal.
Because they could not get this through without the support of those three groups. Those three groups needed to be bought, basically.
High, except that this time, the taxpayers have to pay the price because the taxpayers are subsidizing all this new health care that people got.
So as an individual, you might say, hey, great, I don't have to pay quite as much. But as the American taxpayers go, they got the short end.
Well, as an individual, you are going to pay more because the law does nothing to help you. If you have a private insurance policy, your deductibles are still going to go up every year. Your co-pays and your co-insurance is still going to go up every year because all the prices are going up. And your employer is going to say, we can't keep paying these high premiums, so you have to dig into your pocket.
Is this sustainable? I mean, all these backroom deals led to to be charitable, an imperfect law.
Cannot continue to be a country that spends 18 to 20% of our gross domestic product on health care when all the countries we compete with spend half of that and have the same results. It's not like their care is worse. They have the same results, but they just spend less, because they don't spend what we spend on prescription drugs. They don't have this the farce of so-called non-profit hospitals,
well, and that was
which
part of the deal.
Very profitable.
You point out in the piece that, and in your book, that we didn't get medical malpractice reform as part of this law, that we didn't get the opportunity to buy cheaper drugs from Canada. We didn't get the opportunity to allow certain drugs to be more generally available after 12 years, and so on. So the protections for the consumer on the costs are almost nil. Why did President Obama do it? I mean, I know he needed the support of the groups, but this law, as passed, is such a mess now.
He basically made a choice, and it was the same choice that Governor Romney made in Massachusetts, which is there are two things you can do with health reform. You can get more coverage for people, or you can control the costs. He was told you can get more coverage and you can control the costs. And that's not true. It's not true with Obamacare any more than it was true with Romney.
Got it goes, but I have to ask you quickly, does the law implode on itself?
I think the costs become unsustainable both for the families of America and the taxpayers of America.
Wow. Stephen Brill, good luck with the book.
Thanks.